It's really nice to see patients who want to get better. Patients who want to be involved in their care and want to get better tend to do better, and it makes it for a more pleasant experience for everyone. I'm Dr. Anthony Carantzas. I'm a board-certified orthopedic surgeon. I specialize in knee and shoulder injuries as well as sports medicine. The best thing about being an orthopedic surgeon is getting my patients back to doing the activities that they really enjoy doing. Whether it's going for a walk in the park, or whether it's playing with their kids, or whether they're an athlete for a high school or a college team, usually their goal is to get back to doing what they want to do. And when they get back to that level of activity, that's what's gratifying for me. When I see a patient, the first thing I really want to establish is a sense of trust with them. I want them to understand that I'm trying to get them better. That's the sole purpose of them being here. Once we establish that relationship, usually after a thorough examination, I really like to go over all the different treatment options. I like the patient to be involved in their care. I don't like to tell people what they have to do. I give them options so that we can develop a treatment plan that's best for them. My specialty is sports medicine. I really enjoy seeing people with athletic injuries, whether they're surgical or non-surgical. But in general, I really see patients from all aspects of life. Everyone is not an athlete. And actually, a lot of times, non-athletic people have what we would term really athletic or sports type injuries. I do a lot of fracture work. I do a lot of knee and shoulder work. Those are really primarily my areas of expertise. I did my training in Florida, both medical school and residency. Then I finished my training at the University of Arizona, where I did a sports medicine fellowship. And even though it was a lot of hours involved and it's a lot of hard work, it was really actually an enjoyable experience. I've been married for almost 12 years. I moved to Atlanta shortly after I got married, where we had our first kid. We actually have 3 kids now. All of them are boys, which is actually fun for me. We tend to play a lot of sports together, and that keeps me involved. As far as my hobbies itself are concerned, at this point they really involve around my children. I do like to travel. I'm also into personal fitness, so I really work hard in taking care of myself. One thing a patient can expect from me is honesty. I'm going to tell them what their problem is and what to do to fix it. When I'm treating patients, I generally take a pretty conservative approach. Sometimes people think just because they're coming to see an orthopedic surgeon that definitely means they need surgery. That's not usually the case. There's lots of other treatments that we can do for people that can get them better without surgery. Most of the time, probably 80% or more of the time, we can get rid of most problems without surgery. A patient should be very involved in their care. The more involved they are, the more likely we're going to have success in getting rid of the problem that they have. If we work together to come up with a plan that everyone's in agreement with, then we'll reach our common goal. Sometimes when you're out in the community, going to the grocery store, or for me, I cover a lot of sports events, a patient will come up to you and say, "Hey, Dr. Carantzas, how are you doing?" Or, "Oh, I'm so happy to see you." And then whoever they're standing there with, they always introduce you. "This is my doctor." It really gets you a sense of that they appreciated what you did for them, and it's very gratifying.